therapy is one of the aspects that patients can be most nervous about when they come into Smarmore. It may be the first time that they've opened up in front of so many people. We run groups of around 10 to 12, depending on how many patients we have admitted at that time. The group is a place for the patients to explore any internal conflicts or any issues that they may be having, and they receive the support of the group. Generally in the group, the group can identify with what the person may be feeling, and they can relate back to the person. People are obviously at different points of their treatment, so somebody new in may actually get a lot of support from somebody that may be here for 4 or 5 weeks. The patients are better therapists than we'll ever be, so having the support of the group is so important, and we would encourage people to bring everything that they can to group where appropriate, because generally they're going to meet 2 or 3 people in that group that has been through something similar, can empathise with them and can relate to what they're going through. Can be very scary at the start, but people often say when they're at the end of the treatment that it was the most beneficial part of their treatment.
The therapists see your patients twice a week, one-to-one counselling. They'll get group therapy daily. So the group therapy daily, the group in the morning is more of a process group where any patient's issues that's coming up, we can also do some written work with step 1. And in the afternoon, the group therapy is more about doing their learning about the steps. Also, peer evaluations are in the afternoon. We've got relapse group in the afternoon. We've got step lectures in the afternoon. We've got quite a concise package for our patients that come in. We have to teach our clients about what addiction is to begin with. I think before everything, our patients need to understand why they're here, what was it that brought them to Smarmore. So going in along with the Minnesota model, which is the first 5 steps of the 12-step programme, our patients start to understand what the disease of addiction is, what the illness of addiction is.
Any group therapy, it's a very special environment, group therapy, but can be an intensive environment. So obviously, for somebody coming in who has no experience of group therapy at Gambler, then it's quite a daunting prospect, to really to bring forth what you need to bring in the group. You can't really hide. As I said, there's no corners in the group therapy. You can't hide, and I think that's the piece. That's the powerful piece about the group, because the group spot, the defaults or the defects rather, and that's unavoidable, because in the process of the work, you bring the pieces of work to group, and the feedback comes from what you present. So, in a way, any minimising would be a strong tactic. Minimising harm and behaviour, that can't really be hidden, and that will be spotted, because the best therapists in the place are in the group, and that's we're facilitating groups, and we're guiding, and we're challenging where we need to challenge, and we're encouraging everyone to help everyone else to heal and recover. It's all about that. So I think it's very helpful, the powers in the group. It's very powerful for an addict to come and to face into the reality, because it's unavoidable. You can't avoid it, and that comes through the group process. There's such power in the group process.
I believe the most important therapeutic intervention people receive in Smarmore is group therapy, and for a number of reasons. Addiction is a condition that requires isolation, chronic isolation oftentimes. So in other words, the person who is addicted has to and is driven to keep everybody who cares about them out of their life in some way or fashion. It is like this invisible wall that's built between them and the ones who love them the most. we have to help break through that isolation. And the best way to do that is through the process of group therapy, where everybody begins the process of being seen by people who really understand addiction. And the best people who understand addiction are the fellow patients within Smartmore. And they can begin to be seen, and they can begin to be heard and understood and identified with. And this really breaks through the inherent shame that comes with addiction as well. Because now we have a process of pushing through the isolation, pushing through the shame, and being met in a way that's caring and compassionate and real. And oftentimes that's the first time anybody's ever really encountered that. So the group, and within the group therapy then, sometimes, unfortunate fact of addiction is a level of denial that comes with it. It's one of the only conditions that tells the sufferer it doesn't have it. They don't have it. It's one of the only conditions that tells the sufferer that they don't have it. So oftentimes it requires peers who know the person, who's lived with the person, to actually help them through the process of denial, to help show them where the denial exists within their life. And that can be done no better way than through the process of group therapy. But supplementing that, because nothing happens in isolation. The addiction didn't happen in isolation, so the recovery doesn't happen in isolation, is the support from their one-to-one therapist. So everybody's received a case manager who looks after them, and they go to see them as well on a one-to-one therapy sessions a couple of times a week. And that's another really important part, because that's where maybe the things that are very, very difficult to open up about, they can be begun to look at in the safe space between themselves and the therapist. So I would say that those two would be, and then again, another huge factor is the non-therapy time people spend together within the community. Just spending time together, spending time in downtime also, and engaging with each other and connecting with each other. There's a common phrase out there that addiction is about disconnection and recovery is about connection. And the whole experience of treatment is about connection. It's connecting with us as a team. It's about us connecting with each patient that come in, and it's about the therapeutic community themselves connecting with each other and learning to care for and learning to receive care from each other.